Okay, and now I get to introduce Dr. Daniela Dinulescu, who is from the Department of Pathology at Brigham and Women's Hospital, and she was among the team that worked to identify the fallopian tube secretory cell as the cell of origin for serous ovarian carcinoma and peritoneal tumors. She's going to talk to us today about innovative research to overcome the very troublesome issue of platinum chemoresistance for ovarian carcinomas. Danielle.
Good morning. Thank you for being here, and thank you also for giving me the opportunity to present our work and highlight epigenetic diagnostic and prognostic tools and biomarkers for multiple aggressive tumors, including melanoma and epithelial ovarian cancer. I will briefly discuss key aspects of epigenetic regulation of these biomarkers in tumor development and chemoresistance, and also outline epigenetic reprogramming strategies for cancer therapy. One of the aggressive tumors we're focusing on is epithelial ovarian cancer, which has a high mortality rate, and in which most patients, despite having an initially robust response to platinum-based therapy, will relapse within 2 years following diagnosis. And I should mention that these patients that come in with intrinsic platinum chemoresistant, about 30% of patients, as well as the remainder of the patients who will develop this acquired platinum chemoresistant over the years, have no good therapeutic options right now. And what's more troubling to me is that newly diagnosed patients are not even tested for their platinum chemoresistant, nor are they stratified into different regimens because we have nothing else to offer. There are other treatments, but none of them has shown any increase in progression-free survival or overall survival, or enhance the quality of life in these patients. So clearly there is a big challenge in platinum therapy for these aggressive tumors, and that is the clinical management of chemoresistant tumor cells, and including cancer stem cells, which have a largely unknown molecular pathogenesis of the level of epigenetic regulation. And we are particularly interested in identifying key epigenetic signatures of chemoresistant tumor cells and cancer stem cells as an important step to redesign more efficient therapies for relapsed patients, as well as platinum chemoresistant tumors. And on a personal level, this is a deeply personal issue to me. I started this work because someone close to me was affected by the disease, and I have to say that watching her courageous fight against ovarian cancer has taught me to continue this work with a lot of hope and determination. And I was also lucky to have a great mentor during my training, Dr. Brian Drucker, who together with Novartis in a very productive and strategic alliance with industry, developed Gleevec, which has proven some life savings for so many patients with CML. And he taught us that no matter how difficult the case, no matter if the disease is terminal, it is okay to hope, and that we should tackle challenging issues, and we should do hard work and try to shift paradigms, and I aspire to do this every day. So having said that, I'm just going to briefly discuss our current epigenetic work. So we know that no single genetic event or genetic mutation is responsible for the development of a malignant or chemoresistant phenotype. Furthermore, multiple studies have now shown that distinct aberrant epigenetic events, such as abnormal histone modification or DNA methylation, are all important cancer hallmarks. The recent discovery of the TET family of enzymes, which convert 5MC to 5HMC, 5MC to 5HMC, and have a cofactor of the IDH enzymes, have added an additional layer of complexity to the regulation of DNA methylation in cancer. Our close collaborator on epigenetic studies, Dr. Christine Lian, had the landmark study several years ago, and she has done an epigenetic genome-wide mapping of melanoma and concluded that the global loss of 5-HMC is a key hallmark for aggressive melanoma cases and has both diagnostic and prognostic implications. It appears that the downregulation of the IDH2, which is a cofactor for the TET enzymes, or the downregulation of the TET enzymes is likely the main mechanism responsible for this global loss of 5-HMC in melanoma. Most importantly, these epigenetic changes are reversible, so we can block the growth of aggressive melanoma tumors in animal models of disease by restoring normal 5-HMC levels, and we can do that through overexpression of either the IDH2 or TET2 enzyme. Additional studies from Dr. Lian's group and others have further validated the clinical utility of 5-HMC as a diagnostic marker in the clinical setting, especially when it pertains to differentiating melanoma micrometastasis in sentinel lymph nodes from benign nevide nests, which is a very challenging issue for pathologists, and also in looking and evaluating the degree of melanocytic dysplasia in patients. Most importantly, using global loss of 5-HMC as a biomarker of tumor progression, Dr. Lian and Dr. George Murphy in the dermatopathology department of Brigham have been able to identify potential precursor lesions for melanoma. So they are proposing that the development of melanoma from precursors likely involve fields of atypical junctional melanocytes, which normally occur in chronically sun-damaged skin areas, but also interestingly frequently surround fully excised melanomas. And histologically, these atypical junctional melanocytes do not warrant the designation of melanoma, but like melanomas and unlike normal melanocytes, they show a global loss of the 5-HMC marker as shown here by IF or immunohistochemistry. Interestingly, when we look at a different aggressive tumor, epithelial ovarian cancer, we have seen the same global loss of 5-HMC in a large ovarian cancer biorepository, as shown here. And this was especially true when we look at high-grade serous ovarian tumors, which is the most common and deadliest subtype of epithelial ovarian cases, and we compare to normal and benign cases. Most importantly, our data indicate that 5-HMC may be a sensitive predictor of tumor recurrence after chemotherapy and overall clinical outcome. So our data shows that a global loss of 5-HMC correlates with a shorter time to relapse as well as overall survival. A separate study analyzing all ovarian cancer subtypes, again, a large ovarian cancer biorepository, identified the same correlation. So low 5-HMC level correlated with higher grade advanced stage, increased lymph node metastasis and vascular thrombosis. And what was really striking to me is that, again, similar to our studies, when they looked at the levels of 5-HMC, low 5-HMC levels, high 5-MC levels, and low TET2 levels were all independent prognostic markers for a poor outcome in ovarian cancer. So currently we are developing and validating a sensitive method to detect global epigenetic changes of 5-HMC in newly diagnosed aggressive tumors. So these are the 30% of patients that come in with intrinsic platinum chemo-resistant, and we know from our studies will never respond to platinum and will probably die within a couple months following diagnosis. And we are also looking at chemo-resistant tumors. So these are patients with acquired platinum chemo-resistant and the percent of the cancer stem cells in these tumors. What was exciting to us is that we were able to find targetable pathways, including epigenetic adjuvants that will reverse these epigenetic changes. And the reversal could be stable for several weeks to up to a month, so the platinum chemotherapy has time to work. So once you reverse these epigenetic changes, you can restore 5-HMC levels and increase sensitivity to chemotherapy. And we believe that this will open new avenues to employ epigenetic reprogramming strategies in recurrent patients, and especially platinum-resistant patients that don't have other options. So I'm going to conclude by saying that our work shows the potential utility of using global epigenetic changes such as 5-HMC as prognostic and diagnostic markers that will predict recurrence after chemotherapy and clinical outcome. And we also propose the use of combinatorial therapies, including epigenetic adjuvants, which will prove extremely beneficial for recurrent patients and platinum-resistant tumors. And I thank you for your attention.